Hello, welcome to case-study-3, hypothesis. Fascial remodeling techniques contribute to scar healing and restore joint mobility over 3-session period. The ground for choosing such hypothesis is the following. Firstly, the problem of fibrosis and scar healing is ongoing in the field of massage therapy. And secondly, there are hardly any patients who have never had injuries in the past, whether it was for a result from poor chronic posture, injury, accident, or repetitive strain injury, who after lacking in exercise and proper rehabilitation wouldn't develop fibrosis or scarring. Thus, learning about the fascia technique's effectiveness will contribute to the therapist's future practice. In this case study, there are 3 patients. They have been selected for the treatments of various scar tissues, ranging from recent scarring to longer lasting scarring to a chronic set-in scar. For the sake of convenience, let us represent the 3 patients with letters A, B, and C. Our patient A presented herself with the history of no particular injuries or surgeries in the past, however, has had 2 recent injuries such as a strained ankle resulting from a fall from the stairs and repetitive strain injury to the extensor part of her wrist from improper ergonomics of the mouse device at the computer. Patient B had a longer history of untreated scar tissue at the elbow joint from a repetitive strain to the bicep tendon about 10 years ago. He's otherwise a very healthy individual who did a lot of bodybuilding and weightlifting in the past. And lastly, patient C had a history of broken ulnar bone at the attachment place with the humerus head bone, and improper restoration of the bones at the hospital, which created difficulty of fully extending the elbow after the bone has healed, resulting in more scarring, adhesions, and further restrictions of the range of movement. The age range of the subjects is between 40 and 50 years old. Patients A, B, and C were asked and gave their consent to the treatment plan of 3 sessions, 1 assessment and 3 sessions each, in order to see the rate of improvement. Also, the beneficence and non-maleficence principle has been satisfied, as these patients are regular at the clinic and they are willing to have their issues addressed regarding of the situation. After all, the risks and benefits of the osteopathy treatment has been explained to the clients, and there is no potential harm to clients' health as we went through the treatment plan together. The subject knows what to expect in the treatment sessions. The benefit for a therapist is that he would be paid for each 45-minute sessions and translate this therapy work into his case study work. It's a win-win for both. Biological determinants. There are several lesions associated with our clients that play a contributing role to the current healing process. One remark here, the therapist is trying to choose subjects for their study who exhibit few to none lesions other than the scars I have mentioned, in order to see objectively on the timeliness and the effectiveness of the recovery rate. However, there are some things beyond our control, such as patient A's high-stress job that may contribute to the psychosomatic lesion, which can slow down her recovery rate from a treatment. In fact, it is very likely it could be one of the reasons that her wrist started getting repetitive strain pain syndrome. One can attribute it due to the symptomatic overload, which decreases the blood flow to the far tissues. Patient C also shows signs of stress from working 13 hours shifts daily and spending a lot of time sitting and sleeping on the road. This may contribute to his scar recovery rate regardless of his good general health. One more factor is his diet. Patient C has been on vegetarian diet for the last 2 years, and there is possibility of visceral lesion too, as he feels bloated and has some trouble with digestion in the last 9 months. There are these and other issues may affect his recovery rate from our osteopathy treatment. Things that may improve our client's healing is more time spent taking hours from work, as well as consistent attendance of the health centers who can focus on physical rehabilitation, osteopathy, manual therapy, fascial stretching, and even psychological and spiritual rehabilitation for stress management. Our study was based on 3 45-minute osteopathy manual treatments with the focus on fascial techniques, direct, indirect, spreading, tractioning, tensional release, friction, compression, and long lever techniques, which contribute to fascial remodeling, loosen myofascial layers, and increase the range of motion, followed by the Swedish massage techniques, aka petrissage and effleurage, in the surrounding area and along the fascial chain. Time frame: 25 minutes for fascial techniques and 20 minutes for the massage techniques. Assessment and reassessments are used as tools to measure the results of the study. Active and passive range of motion is used to see the degrees of change in the joint area. The palpation is used to measure tone, elasticity, mobility, temperature, and tension of the scar and the surrounding muscles. Results: Patient A, a recent scar patient, has had 2 lesions, one at the wrist and the other at the ankle. Both joints have completely regained their range of motion. Also, her elasticity has improved, fascial glide improved, and tonicity went down. Temperature is back to normal. The client's improvement rate is 90% better. Objectively, she has proved the hypothesis, though fascial remodeling develops at a slower rate for around 6 to 24 months to have the full effect on the fascial system, and her injury was fairly light and recent enough, which helped to prevent the tissues from ongoing fibrosis. Patient B, the longer-lasting scar patient, who has improvement in his elbow with tone elasticity and range of motion. However, his bicep tendon tear scar has been there for the last 10-year period. So with palpation, the therapist was able to feel that the fibrous scar is still there. However, the sensitivity is decreased by 50%. The subject clearly needs more than 3 sessions to resolve the issue completely. And then patient C has had the following results. His range of movement at the elbow went from 150 degrees to 170 degrees in passive range of motion, and from 140 degrees to 160 in active range of motion. The sensitivity went down from 100 to 70%. However, the tone of the scar is still felt strong, and the color of the area is usually more pale. This subject has the most chronic scar out of the other patients, and it is even evident that 3 sessions do improve his elbow joint by 30%. However, more work and more time is required to help him recover completely. Now, regarding their personal treatment plans, patients A, B, and C have approved the treatment plan provided by the therapist, satisfying the partnership principle of manual osteopathy. As for our immediate goals, we have determined to spend 4 sessions, of which the first one is meant to properly assess their posture, gait, and then bowstring theory assessment, the GOT test, the muscle strength flexibility test before commencing with the treatment. At the second, third, and fourth sessions, we specifically challenging our hypothesis and working with the wrist, elbow, ankle joint assessment, checking the fascia, viscoelastic properties, then treatment and reassessment, of course. The therapist uses compression, friction, and tensional release fascial techniques, following up with the massage of the muscles of the joint. At the last treatment session, we reassess again and measure posture with screening test and we go right back into the fascial remodeling techniques targeting the scars and nearby structures, following up with affleurage and patrissage massage techniques to the joint of the limb. All in all, we have come up with a plan to work towards the client's proper alignment and even discuss possibility of attending other referred places to better integrate our holistic approach. The appointments were held once a week for 3 weeks, 1 hour per session. The first 15 minutes taken for assessment purpose only. The patients were asked not to pay the fees for the full hour, but only for the 45-minute sessions, as they are subjects for the educational case study. The cost-benefit analysis shows that this is a win-win case. The result of the case study clearly indicates that there is considerable improvement in the subject's scars reductions, with the linear correlation in the degree of the severity and the age of the scar. So, by that I want to demonstrate you a chart and show you what exactly I mean. This is the percent of recovery, so 100%. This is the age of the scar. So we have from 5 to 25 years. And this is from 0 to 100% recovery. This is our patient A, patient B, patient C. As we know, the patient A, who had a fairly recent injury, her recovery rate was up to 90%. Patient B, 10 years, his recovery was of the scar improvement was 50%. And patient C had 25-year-old scar from broken bone and not properly, didn't properly grow together. So his improvement was only 30%. And so as I mentioned, it is almost a linear correlation to the age of the scar and the improvement rate from 3 sessions only. Specific findings indicate the lessening of tension sensitivity, increase in fascial glide, and in the restoration of the range of motion. The goal was to see if osteopathy fascial remodeling approach can be used effectively in 3 sessions in dealing with the scar tissues. Particularly interesting is the fact that usually the results are not there after the first session and only with the 40% of improvement after the second session. However, significant measurable improvement come only at or after the third treatment. The therapist does acknowledge there are limitations in the amount of treatments used and duration of time allowed for the fascia to properly remodel itself. Also, the techniques used and the areas of fascial release can be extended more. For instance, the therapist could address more thoroughly the fascial chain lines and work more along them. The time span in the treatment was relatively short as to what fascia requires in order to respond to pressure. And I'm just having a little bit of a technical difficulty right now. So just give me 1 second. Okay, it went back up. I just have to find the last page. Yes. And we'll resume video in the next video.